Coming to Freud's original theory of pain, whatever the cause, pain is always real and violent. And much later, the most difficult part is the passage from the pain of body to pain of psyche. Beside the opinions of philosophers or scientists in the early time of human history, religions had another opinion. In Christianity, for example, evil and suffering in his life is considered as a preparation for heaven. God wants people to follow the example of Jesus and help those who are suffering. God must have a reason for following evil and suffering, but the reason is beyond human understanding. Christians always pray for those who suffer and try to help them. Suffering is not a mere sensation like pain, neither an emotion like sadness. It's a state that encompasses our whole mind, made not just of negative emotions, but also of thoughts, beliefs, and the quality of our consciousness itself. The influence of the church persisted and was evident up to the 19th century. Traditional Catholic religions maintained that pain was rooted in the passion and death of Christ. That suffering individuals were closer to Christ. Buddha, from the other side, considered pain is inevitable, but suffering is optional. Suffering has the capacity to show the path to liberation by following the Four Noble Truths. His four truths actually are acknowledging the existence of suffering, seeking the cause of suffering, letting go of attachment and desire, and the fourth one is the path which is leading to the end of suffering, to the spiritual enlightenment leading to the end of suffering. So in conclusion, one should embrace his suffering and let it reveal the way to peace. Pain in Islam came as a trial, al-ikhtibar. Man has to acknowledge the source of the trial that might help to know where to seek answers and relief. And this is an important step in dealing with pain and grief. One should remember the power of God whenever he is going through a painful trial. Humans find comfort in rationalizing their situation when they acknowledge the source of the trial. Getting angry or denying every good in one's life is considered as a trick of shaitan. Every illness that a Muslim feels wipes away some sins. So from that perspective, asking God through dua and the prayers for relief from the pain and to be an expiation of sins. When we shift to a definition of pain, what is it? So when you are in pain, does it matter to know if it is a disease or a symptom? For people living and suffering with pain, such a question may seem irrelevant. They might say, hey, I don't care what category you put me in. Don't just talk about it. Do something, anything to relieve this agony. It's only in 1974 the medical society started to be interested in pain and in pain research and management by the creation of the International Association for the Study of Pain, having clinicians and researchers engaged in the study and treatment of pain. During the 7th Congress of the International Association for the Study of Pain in 1993 in France, started the real battle against pain. That was translated by a governmental action through the Ministry of Health, changing the paradigm of dealing with pain from a normal symptom to an alarming symptom that healthcare providers should consider as a priority to treat. In his letter, the French Minister of Health at that time started to work on a law, came in application in 2002, giving the right for every patient to have all possible treatment for all types of pain. And even the quality of health services started to be measured, among other elements, by the quality of pain management. The Ministry of Health, together with the French Organization for Pain, put a mission for all clinicians and people, physicians concerned by the pain. That mission was having the name Question of Pain, La douleur en question, to encourage doctors in all specialties to be aware of care of pain as fundamental approach to all types of patients. Today, it is la Société Française d'Études et de Traitement de la Douleur. Cette association is considered as one of the principal promoters for pain management in the world. The French Society embraces 37 medical specialties, plus researchers, lawyers, and psychoanalysts. So when we classify types of pain, we will find many classifications, including acute and chronic. Acute pain, it is the short pain or pain of short duration, like post any trauma or surgery, for example. The chronic one, it's relatively longer duration pain. So that related to some chronic disease like cancer or neuropathic pathologies, or like rheumatoid arthritis, for example. There is another classification depending more in its 4 major components. These components, we can't really separate between them, but they are the components, the sum of the pain itself. So divided into sensory, affective, cognitive, and behavioral. The sensory, it's concerning the sense of the intensity, the location, the quality, and duration of pain. The affective, concerning the feeling of unpleasantness. The cognitive, concerning the perception, the anticipation, and controlling the attention that permits the person to have a strategy for attenuation or avoidance of pain. And fourthly, the behavioral. We should know that the painful sensation, it's unpleasant, distressing, unbearable tone, it can extend into more differentiated emotional states such as anxiety or depression, especially in the case of chronic pain. Actually, the pain is modulated by the nature of the disease causing it. There is a question: do newborns and fetuses have pain? The answer is yes. Fetus starts to have a developed nervous structure to receive stimuli during its early life in the uterus. Now, as an obstetrician, it would be really strange if I don't touch one of the major pains in human life, which is labor pain. Le mal joli. Le mal joli, or the pretty evil, is the French term was used in all time to describe the labor pain. In the description of pain as a biological warning mechanism, which allows to react effectively to any source of aggression, we don't really understand the nature of pain in such natural event that's supposed to be a happy moment. A happy moment in women and in couples' life. The explanation of such a process in animals and birds' life, we can understand it because we can understand that that pain will push the mother animal to prepare the place or the nest for the coming newborn. But in human, measuring the pain's intensity is extremely subjective. So that's why its expression is variable on the individual and social level. Many theories were put to explain the labor pain. One of the nice theories that really I liked was established in 1960 by an anthropologist named Sherwood Washburn and was named after him. It was called as well the Obstetrical Dilemma. The idea of Washburn actually is that big brain adults start out life as big brain babies. So evolution came into conflict with itself. On the one hand, female hominids had to maintain a narrow pelvis. Try to imagine this with me. The female hominids, the human female, had to maintain a narrow pelvis with a constricted birth canal in order to walk, walking on two legs. But at the same time, the fetus they carry were evolving to have a larger head. The human brain is much bigger than others animals' heads. So these were actually these larger heads were a little bit tighter and tighter to fit through those narrow pelvis that we need to have it narrower and narrower to be able to walk. So childbirth became a distressingly painful and potentially lethal business and remains so to our day. The female pelvis really is tightly governed by two opposing forces. They need to be narrow for walking and they need to be wide for giving birth. Another theory talking about the delivery, so the energetics of pregnancy and growth hypothesis by Dunsworth. It suggests the timing of childbirth is governed by the difficulties of continuing to nourish a developing fetus beyond 9 months, not by the difficulties of squeezing the baby out through the birth canal. We know that the social effect on the expression of pain is so evident. We see it as obstetricians or midwives and nurses in the labor room. So some societies are more tolerating than some others. This means that the way how we react, manage, and master the expression of pain is more real than the intrinsic quality of painful sensation. Actually, there are many methods for managing the pain during labor. First, the natural methods which are there to give a soothing environment, like learning about labor, expressing the fears, rhythmic breathing, relaxation by music, relaxation by warm shower and bath, keeping moving, reflexology, aromatherapy, TENS, which is transcutaneous electrical nerve stimulation, massage. On the other hand, we have the analgesics, mainly gas, which is Ontonox, a mix between oxygen nitrous oxide gas that we can use during labor, bethidine, and epidural.